Now, if you woke up this morning afraid that you wouldn't be able to get out of bed without pain, or maybe you're worried about a loved one who has back or neck pain falling, you'll want to learn more about the procedures and people who can help at Total Health Chiropractic. Take a listen. We're here at Total Health Chiropractic, and today we're going to talk about fear. Okay, a lot of people wake up thinking, they're scared. Is today the day that they're going to fall because their knee gives out? Or are they going to tweak their back? Maybe they're scared because they don't want to continue taking that pain medication for fear of addiction. Maybe they've got the news that back surgery is in their future. There are so many fears out there, Dr. Miller, when it comes to lower back pain. So how do we appease those fears? How do we address them?
Well, I think a lot of it is just teaching our patients and educating them on what's wrong and what their options are. Because the fact is, most of these patients that live in fear, it's not just the pain that they endure, but it affects their body's ability to function. You know, like you said, when they have pinched nerves that affect the legs, sometimes it causes weakness and they can't control the leg movement, or they may inadvertently, their leg goes out and they fall down, and that could create other injuries. Sometimes if it's in the arms or hands, they may be dropping things or not be able to grip things. That can affect just everyday life and chores. It can affect driving to get to appointments or different events. And many times I find when I speak to these patients, they've done what's been recommended, the medications or drugs. They've done physical therapy, shots at the pain clinic. Some even gone to get back or neck surgery. And many of them, after they go through all that, they never really understood what the problem was. A lot of times they don't really understand what the treatment is doing. And so, there is a lot of fear between not only the treatments, but what the future beholds. And so that's something we really pride ourselves on here, is that we want to educate our patients. I spend a lot of time diagnosing their condition properly and actually showing them with images so that they can see with their own eyes what the problem is. And then we talk about different options for treatments and pros and cons of each. Even things that we don't offer here, many times we'll cover. But our goal is to just get them to understand the situation so they feel, educated and comfortable in the decision that they make.
There's a couple more fears there. I mean, the fear of not being able to live life to the fullest, as you mentioned, just getting through your day-to-day, and fear of the unknown. Fear of not knowing what the actual problem is. That's a big one, because people really need to know that information. And I'm sure folks who come here feel a lot better once they've realized that, it's degenerative disc disease or whatever other issue they may be facing. Let's talk a little bit about those discs, though, because that's a big thing that DRX 9000 machine that you have back there addresses.
Sure. So when we find patients that struggle with these issues, it is many times degeneration of the spine. And with that comes the discs that degenerate. And those are pads and spacers between the bones or vertebrae in our spine. And over time, with stress and neglect, they will start to dry out, and then because of that, they shrink down in height, and then the bones become closer and start encroaching or pinching the nerves. Also, they become very brittle and hard, almost like a dried sponge. So when they're trying to live their life and move, it's not really acting as a shock absorber. They'll get more of this jarring action, and that can easily inflame and pinch the nerves. And then even worse, those brittle discs that are degenerated over time can start to tear or rip. And then as the pressure continues to build, they'll actually bulge or herniate into the nerves. And it can be a very painful condition, but also, as we spoke earlier, very limiting in their ability to function.
And I know that Sherry, who joins us today, has gone through a lot of those different therapies before coming here. We're going to hear directly from her in a moment, but let's address how the DRX 9000 actually solves this problem.
Well, Todd, DRX 9000 therapy is very unique to West Michigan, and we've been doing this over 15 years. It's a very specific medical device to actually heal and regenerate those conditions we talked about. So that's why our patients can go live a normal life once again and, have no or less pain or function and do the things they want to do, because we're not just masking the symptoms, we're actually fixing the cause. And a lot of them really enjoy the fact that it's non-invasive, so they don't have to worry about the drug shots or surgery. It's a natural way to rehabilitate the body and the discs so that they can feel better and live the life they want.
And Sherry obviously has been through this with you and is feeling much better, but another fear, of course, the fear of the cost. Okay, a lot of people are like, what is it going to run on me to be able to do this. And you're making it really easy to get the foot in the door. You've appeased that fear as well with this great special.
Absolutely. If they call our office today, Todd, take advantage of our special for $47. We'll do the consultation and an examination so we can get to the root of their problems and see what's causing their pain or lack of function. And then for the first 3 callers, I'll also do a free MRI review. So if they have their MRI report or images and bring it, I'll go through that with them and show them and educate them on what's wrong and why they're having these problems. So these were Sherry's x-rays that we took. These are the neck and these are the lower back and hips. But I really want to focus on these 2 lateral views. These are both like she's facing this direction. And in her neck, the discs are these spaces here between the bones, and as she got in her lower neck, it's essentially bone-on-bone degenerative disc disease. That's what was causing the stenosis and pinching the nerves in her neck that affected her hand. In the lower back here as well, you can see the space between L3 and L4. That's more what a good disc should look like. And also in her lower back, it was essentially bone-on-bone degenerative disc disease. So that degeneration in her spine is what was affecting the nerves and causing her symptoms in her neck and back, and also in her leg, and why she continued to fall. So by correcting these discs and thickening them up with DRX therapy, she's able to live her life once again and not have those concerns and the pain she had before.
Sherry, tell us a little bit about yourself and what the issue was when it started and what you were feeling.
Well, I've had a lot of surgery over time, arthritis and different things. But the last surgery I had, I fell twice in one day after I got home and had to go back to the hospital. And when I finally got home from the hospital, the side of my hand was completely numb and it hurt. And so I went to my hand doctor. They said it was a pinched nerve in my neck, and they don't do much surgery on necks. And he said, guess we'll just have to wait and see. And I waited for a while, but it was still hurting so bad. So I came in and found out that my discs were pinched, but I just feel so much more confident now that I'm not going to be falling. I mean, it was a matter of falling every couple months, and I'm very pleased with the service I've had. Everybody here is very friendly, makes you feel right at home. My neck is much better. They did give me exercises, and I know I have to do these exercises every day. And yet, that is what's going to keep me going.
Thanks again, Sherry, for sharing your story with us, and congratulations on this newfound freedom and lack of fear, which is what we're talking about today. Total Health Chiropractic. Quit living in fear of the needles, of the drug addictions, for those painkillers, of just everyday life. Get to Total Health Chiropractic. You heard the special Dr. Miller is offering, less than $50, get you in the door, get those answers that you need.